either they won't get it or that if they do get it, they'll be fine. We've never dealt with this virus before. You know, do you want to be in that group of people who are just trying to figure it out? Hey everybody, it's Dr. Z here, back again for another video. Today I want to talk about COVID-19. Now I know you've been hearing a lot about this, as you should. It's a global pandemic. So I wanted to talk today about COVID-19 long haulers. So you may have heard of these people. These are people who have had symptoms of COVID-19 for, upwards of 2 to 3 months. And so we're kind of just getting this information now because, the pandemic first started hitting, in January, February, March. And so, people who got those initial infections, there's a subset of people who are still showing symptoms months later. And this is very worrisome. Like, this is not a joke. This is not just the mild flu that people were saying back in February, March that, you'd pass in a couple of days. This is not that. This is a novel virus, and as more information comes out, we're able to see that. We didn't have that information back then. So, what are these symptoms? These symptoms are crazy. So people are having GI symptoms, so they're having stomach pains, they're just having, problems with their digestive system. They're having, ongoing shortness of breath, right? So your lungs, it's a respiratory virus. So, this virus is affecting your lung tissue, your lung organs. So, the whole way the lungs work is that they're able to expand and contract to let oxygen in. They're scarred. If the tissue is scarred, it's not going to be able to expand and contract as well as normal tissue does. So you'll be short of breath, which is obviously not a good thing. It's also causing hypercoagulability, which can lead to blood clots, can lead to strokes, can lead to heart attacks. Like, it can lead to a number of things. It's really a serious thing. And most crazy of all, it seems like this virus can cross the blood-brain barrier, so it can cause neurological symptoms. It can cause seizures, it can cause tremors, even memory loss. Like, this is not a virus to be played with. I know you've all been told to wear your mask, wash your hands, practice social distancing, but a lot of people who aren't doing those things, I feel like it's because they think that this is some mild virus that either they won't get it or that if they do get it, they'll be fine. We've never dealt with this virus before. Do you want to be in that group of people who are just trying to figure it out? We'll throw some treatments at you and hopefully something works. It's nothing to be played around with. In the US alone, we've had over 150,000 deaths and over 5 million cases. And these are people who are a good subset of these people, of the 5 million who haven't passed away, will have ongoing symptoms from it. And so for those of you who, haven't been practicing social distancing, who haven't been wearing masks, haven't been washing your hands, which should have been doing before, it's not a joke, especially for us in the 18 to 34 age range, right? Where we think we're invincible, we think we can do whatever we want. Like, cases are highest in that age group now because I don't think we've been taking it as seriously as we should be. So please continue to shelter in place, try to stay at home as much as possible, wash your hands, wear your mask, please. We're gonna get through this. The vaccines, there are actually gonna be multiple vaccines. They are scheduled for mid-2021, summer 2021. So they are coming, but we gotta make it there. And so let's take care of one another, all right?